Jim. It's very good to have you here today.
Well, first of all, it's wonderful to be with you and me after many, many years, and when we studied together at Brown University.
Let me just start with the first question. As a medical doctor and co-founder of Partners in Health and former president of the World Bank, what has caught your attention the most in the COVID-19 pandemic?
This was something that we warned the world could happen. In fact, in October of 2018, the World Bank Group put out a document that basically said pandemic like COVID-19 can happen. The world is unprepared and we have to get prepared right away. Of course, it was also ignored. And the countries that didn't take seriously the possibility of what a pandemic like this could do have been absolutely devastated. The countries that were prepared, like Korea, the countries that had experienced something as frightening as what we're going through right now, were prepared and now are battling the virus. But this is the most difficult virus that we've ever had to face. And unfortunately, some of the most advanced countries in the world are really struggling.
This is not the first one, as you said. It's a cycle of panic, and neglect, and we're here now. What do you think the global health governance should change in order to better deal with crises like COVID-19 in the future?
This is probably the fourth or fifth time that something bad has happened, whether it's HIV or tuberculosis, cholera, Ebola. Each time we have a public health problem, I hear people saying, well, we really have to think about global governance around health and we have to have conferences, and they never lead to anything. The key is to have enlightened leaders who can support the system. And so I know the World Health Organization very well. They're doing a great job right now. They're doing a very good job. They're communicating well. But right now, unfortunately, very few countries are listening to them. We need to support them and give them the kind of financing, give them the kind of mandate that they need to operate. I don't think it's going to get better if we recreate it. It's not a structural issue. It's the governments embracing these systems and being willing to give up some of their own selfish concerns for the good of the world.
Now, in this post-corona situation where many countries are going to clamp down on their budgetary expenses, I'm concerned that the budget that we used to provide for development assistance is going to go down.
Maybe a decade plus ago, and the so-called HIPC, the Highly Indebted Poor Country Initiative. And it was done with the promise that this is one time and we're never going to do it again, right? But I don't think that anyone saw this kind of disaster coming down the pike. And so I think there's going to have to be debt relief. When it was mostly debt from multilateral agencies, it was and mostly debt to governments, it was easier to handle. But now the debt situation is very different. There's a lot of private debt. There's a lot of debt that came from specific countries to African private sector players, for example. So the debt situation is much more complicated, but I just think there's no other way around it. I think, at the very least, delaying debt payment, but also I think debt relief is going to be something that's going to be really important to allow the countries to have enough resources to build out their healthcare systems.
Korea has been working with WHO and United Nations on global responses, including the UN COVID-19 response and recovery. President Moon Jae-in spoke at the World Health Assembly in May 18th this year. He talked about providing an aid program worth about $30 million called COVID-19 Comprehensive Emergency Assistance Program, and other programs, another $100 million for humanitarian assistance to countries and people in need. They just announced also ODA Korea Building Trust, Transparency, Resilience, Unity, and safety together to combat global COVID-19 crisis around the world.
You know, Korea has made a huge contribution to the world in just being successful fighting COVID-19. You know, the specific way that Korea did it, responded very quickly, used very sophisticated technology, didn't shut down the entire economy, but did it in a very focused way, and still is chasing down every single transmission event. They need to keep doing that.
You had done, when you were at the World Bank, a lot of significance for providing greater assistance to fragile states and conflict-affected states. What's happening to those countries in the COVID-19 crisis?
Yemen is really struggling with coronavirus. I think the other, some of the fragile states in Africa, I think we just haven't had a lot of testing yet done. Nations in sub-Saharan Africa responded relatively quickly, took a lot of very strong measures. My understanding is that the pandemic has not yet taken off, but it could take off. And because what we discussed earlier, that there's really not a lot of ability to provide the massive kind of financing that's needed, you know, I'm worried. I'm worried about the fragile states.
You started the World Bank's Pandemic Emergency Financing Facility. Do you know if that's still active? Has it been able to play a role in the COVID-19 response?
I think it's now finally beginning to play a role, but it didn't play the role that I'd hoped for. And the idea was that it would release funds very quickly and it would help the poorest countries deal with these pandemics, but it took very long. You know, the Ebola response took 8 months for anyone to put any money on the table. And the World Bank actually was the first institution or country that provided any financial assistance. We did it in August of 2014. Unfortunately, it didn't happen this time. And part of it is that COVID just moved way too fast for this facility. The idea behind it was important. Can we use the capital markets to ensure the poorest countries in their fight against pandemics? What the World Bank is going to do, I'm not there anymore, is to go back and look at why it didn't work, and then think about other ways of again, potentially using capital markets or some mechanism. I'm not sure what it would be, to ensure that there is an assured supply of financing for developing the poorest countries, anyway, the poorest countries in responding to pandemics.
Is there something to learn something from this so that we don't repeat the same mistake in the future?
The two things that I think are most important in a successful response to COVID is, the first is humility. You have to be humble in front of the virus. And when I talked to the Korean CDC people back in March, they had an intimate knowledge of the virus, but also had a humility and respect for what it could do. Then the most important thing is solidarity. On the one hand, most people probably think I'm wearing a mask to protect myself. It's not. The most important thing is you protect others, right? You wearing a mask for preventing you from spewing it out. And on top of that, the really sophisticated technology that you're using, that has to be shared with the rest of the world.
You've credited your philosopher mother for introducing you to the writings of Martin Luther King Jr. and instilling you in a sense of responsibility to the world. How do we inspire the sentiment on a global scale?
I have tried to inspire others, not just by speaking, but by actually tackling real problems, right? And so what I've done is mentored many young people and encouraged them to tackle the most difficult problems, and don't expect them to yield to your idealism. The work we did in treating drug-resistant tuberculosis, the work I did with Dr. Jong-uk Lee, with Lee Jong-uk, on bringing HIV treatment to Africa, those were not easy fights. And so I didn't do it because I thought that this was a big idea, or that that people would thank me for it. Really wrong, right? I say this all the time. I've seen so many young people go to some of our project sites, and they expect poor people to be both compliant and grateful, and they're most often neither. For me, it's been the most rewarding thing I can imagine. That going through the enormous difficulty of tackling incredibly difficult problems with just endless frustration, and then just persisting, continuing, keep continuing to go at it. I always tell people one of my favorite sayings in Korean is 젊은 고생 사수도 한다. That it's important to have hardships when you're young, even if you have to pay for it. When you're young, tackling these most difficult problems teaches you so much more than a classroom. Teaches you so much more from taking the standard route. These are really important.
But Jim, I cannot thank you enough for spending your time with us and your inspiring stories. And I hope these messages will reach the young people in particular, as well as governments. Thank you so much.
Thank you, Ami. Great talking to you.